7 early warning signs of cervical cancer and 5 effective ways to help prevent it. Cervical cancer is one of the most dangerous diseases affecting women. However, the good news is that when detected early, it can often be treated successfully and managed effectively. The challenge is that early-stage cervical cancer often causes no obvious symptoms, leading many women to overlook the warning signs. However, your body may send early signals that you should never ignore. In this video, Healthy Lifestyle Podcast channel will explore 7 important warning signs that may help you recognize cervical cancer in its earliest stages. If you notice any of these symptoms, don't hesitate. Seek medical attention as soon as possible to protect your health. In addition, we'll also share 5 practical lifestyle tips that may help reduce your risk of developing this serious disease. Now, let's begin with the 7 early warning signs of cervical cancer. Number 1. Abnormal vaginal bleeding. Abnormal vaginal bleeding is one of the most common early signs of cervical cancer. You may experience bleeding between menstrual periods, after sexual intercourse, or even after menopause. The amount of bleeding may vary, but if it occurs without a clear cause, it should never be ignored. This may indicate damage or abnormal cell growth in the cervix. Besides cervical cancer, abnormal bleeding may also be associated with infections or other gynecological conditions. Number 2. Unusual vaginal discharge. Changes in the color, odor, or amount of vaginal discharge can also be a concerning warning sign. If you notice brown-colored discharge, blood-stained discharge, or discharge with a foul odor, pay close attention. These changes may result from the growth of cancer cells causing inflammation and irritation in the cervix. Normal vaginal discharge is typically clear or milky white, odorless, and does not cause itching. Any persistent change in vaginal discharge could be a sign of a gynecological condition, including cervical cancer. Don't hesitate to see a healthcare provider if these symptoms continue. Number 3. Pain or discomfort during sexual intercourse. If you experience pain during sexual intercourse, it could be a sign of several underlying health problems, including cervical cancer. As a tumor grows, the cervix may become more sensitive, making it easier to injure and causing pain during intercourse. In addition to pain, you may also notice light bleeding afterward. Many people assume this is normal, but it can actually be a warning sign of a serious condition. If pain during intercourse persists, consult your doctor for an examination. Early diagnosis allows for timely treatment and helps prevent more serious complications. Number 4. Pelvic or lower back pain. A dull ache in the pelvic area or lower back may be an early warning sign of cervical cancer. At first, the pain may be mild and occasional, making it easy to dismiss. However, as the tumor grows, the discomfort may become more frequent and more intense. The pain may radiate down the thighs or be accompanied by bloating and abdominal discomfort. Many women mistake these symptoms for menstrual cramps or stress-related pain. If the pain persists without a clear cause, seek medical evaluation to rule out cervical cancer. If you find this information helpful, please like this video, subscribe to our channel, and turn on notifications so you can stay updated with our latest health information. Number 5. Digestive problems and urinary changes. Cervical cancer can affect the bladder and intestines, leading to urinary and digestive problems. You may experience frequent urination, pain while urinating, or a constant urge to urinate even when your bladder is not full. In some cases, urinary incontinence or blood in the urine may occur. You may also suffer from persistent constipation or ongoing abdominal bloating. These symptoms can result from the tumor pressing against nearby organs. If you notice persistent changes in your digestive system or urinary function, don't ignore them. Seek medical attention promptly. Number 6. Sudden weight loss. Feeling constantly tired and losing weight rapidly without a clear reason is a warning sign that should never be overlooked. You may lose your appetite even though your eating habits have not changed. At this stage, your immune system may be working hard to fight the growth of cancer cells, leaving you feeling weak and exhausted. This is a common symptom of many types of cancer, not just cervical cancer. In addition to weight loss, you may also experience anemia, pale skin, and frequent dizziness. If you're losing weight unexpectedly without a clear explanation, see your doctor immediately to determine the underlying cause. Number 7. Abnormal menstrual cycles. Significant changes in your menstrual cycle may be an early warning sign of cervical cancer. Your periods may last longer than usual, menstrual blood may appear darker than normal, or you may notice unusual blood clots. Some women may experience unusually heavy bleeding or suddenly stop having periods despite not being pregnant. As the tumor grows, it can interfere with the normal function of the uterus and ovaries. Many women assume these changes are simply caused by hormonal imbalances, but in some cases, they may indicate something much more serious. If your menstrual cycle changes significantly and the problem persists, consult your doctor for a proper evaluation. We have just explored the 7 common warning signs of early-stage cervical cancer. Detecting cervical cancer early is one of the most important factors in improving the chances of successful treatment. But instead of waiting for the disease to develop, why not take proactive steps to help prevent it starting today? Here are 5 practical tips that can help lower your risk of cervical cancer and protect your long-term health. Number 1. Get the HPV vaccine as early as possible. The human papillomavirus, HPV, is the leading cause of cervical cancer, and vaccination is one of the most effective ways to protect yourself. Girls and women between the ages of 9 and 26 are encouraged to receive the HPV vaccine to reduce their future risk of cervical cancer. Even if you have already become sexually active, the vaccine can still help protect against several high-risk strains of HPV. Getting vaccinated early gives your immune system the best opportunity to build strong protection against the virus. Visit a trusted healthcare provider to receive professional guidance and complete the vaccination according to the recommended schedule. Number 2. Have regular gynecological checkups and cervical cancer screening. Early-stage cervical cancer often causes no obvious symptoms, which is why routine screening is so important. Women should have a gynecological examination at least once or twice a year to monitor their reproductive health. Pap smear and HPV tests can detect abnormal cervical cells before they develop into cancer. If any suspicious findings are detected, your doctor may recommend additional diagnostic tests for a more accurate evaluation. The earlier cervical cancer is detected, the greater the chance of successful treatment. Number 3. Maintain proper intimate hygiene. Poor intimate hygiene can increase the risk of HPV infection and other gynecological infections. Avoid douching and avoid using harsh feminine hygiene products that contain strong chemicals. Choose breathable cotton underwear and change it regularly to prevent bacterial growth. During your menstrual period, change your sanitary pad every 4 to 6 hours to reduce the risk of infection. Practicing safe sex is also an important step in lowering your risk of HPV infection. Number 4. Maintain a healthy lifestyle and eat a balanced diet. A nutritious, well-balanced diet helps strengthen your immune system and may reduce your risk of cancer. Eat plenty of fresh vegetables, fruits, and foods rich in vitamins A, C, and E to help protect the cells of the cervix. Limit processed foods, greasy meals, and alcoholic beverages, as they can weaken your immune system. Regular exercise helps keep your body healthy and reduces the risk of obesity, which is considered a risk factor for several types of cancer. Start building healthy lifestyle habits today to protect your health for years to come. Number 5. Manage stress, get enough sleep, and maintain hormonal balance. Chronic stress can disrupt hormone levels, weaken the immune system, and potentially increase the risk of cancer. Take time to relax by practicing yoga, meditation, or participating in activities you genuinely enjoy to help maintain emotional balance. Getting 7 to 8 hours of sleep each night allows your body to recover and helps reduce the risk of hormonal imbalance. If you experience irregular menstrual cycles, early menopause, or other hormone-related concerns, consult your healthcare provider for appropriate evaluation and guidance. A relaxed mind and a balanced lifestyle can help keep your body healthy and reduce your risk of disease. Conclusion. Cervical cancer does not appear suddenly. In most cases, your body provides early warning signs long before the disease reaches an advanced stage. Listening to your body and recognizing unusual symptoms can help you detect the disease early, when treatment is most effective. Don't wait until the condition becomes severe before paying attention to your health. Schedule regular gynecological checkups and undergo recommended screening tests to protect yourself from this serious disease. Your health is your greatest asset. Take care of yourself and begin taking preventive steps today. Thank you so much for watching today's video all the way to the end. Please leave a like and share your thoughts in the comments to help more people discover this video. And don't forget to subscribe to our channel for more valuable health information and practical wellness tips. As always, Healthy Lifestyle Podcast channel wishes you good health, a long life, lasting prosperity, and abundant happiness.